In response to this recent article in the U.S. News and World Report, making the statement on its headline, "Long-term estrogen therapy does up breast cancer risk," that title, again I urge intelligent women and their doctors to be wary of sweeping statements that all hormones are bad. All hormones are not bad. Some are wonderful, some are less good for us. Here are the facts you need in order to put into perspective what you're seeing in the news. 87% of breast cancer in women occurs after the age of 42. Why? What happens after age 42? That's when our estrogen levels begin to plummet, our progesterone levels disappear. Hormone replacement therapy, appropriately prescribed at that time, can give you a longer and better life. You can experience better bone strength and density, a better sexual life, better cognitive function, as well as better cardiovascular health and better breast health. My point is, women should be very careful to distinguish important differences between hormone therapy regimens, since the media usually does not. All hormones are not alike. What you need to know about hormones are: what is the product that women were taking? What are the regimens that they were taking, and by what route they were taking? The product estrogen, if it's human bioidentical, it's estradiol usually, or estrone, sometimes estriol, is very different from the conjugated equine estrogens, which are pregnant mare urine extracts. Progesterone is a natural human bioidentical hormone available from Big Pharma and can be swallowed with safety. But the synthetic progestins have a great many adverse effects that have been shown in the literature. The route: if you swallow estrogen, it's not so good. If you take it by any other route, it's much better. What about the regimen? The young woman that I talked about, the fertile woman who has a cycle, that cycle has estrogen in her bloodstream every day of the month, rising and falling and rising and falling twice a month. The progesterone will not be found at all the first half of the month if her blood is taken and sent to a lab. The second half, after ovulation, progesterone rises and falls. Well, guess what? Every research study I have seen that examined the difference between a sequential regimen of progesterone that mimics the young woman's natural regimen produces benefits, that is, to the bone, to the brain, to the breast tissue, to cognitive executive function. But women should know that when a headline trumpets that hormone replacement therapy ups breast cancer, you need to ask what kind of hormones, what were taken, for how long. When you do that, as I have done in my analysis, you will find that the regimens that do increase the breast cancer risk are the ones that I think are not the ones you should be taking. I urge women, don't let a sensationalistic headline affect your healthcare regimen until you understand the relationship between your body and what you're doing and how it fits what that study's population tested.